I want to welcome each of you for this Q&A webinar on the UNICEF guidelines and community-based MHPSS in humanitarian settings. So this webinar, we have a few differences from the previous webinars. If it's the first time you are coming to watch one of our webinars, I want to welcome you, give you a warm welcome, and say that we often have these webinars. And if it's not the first time, you have noticed that we have a different platform. This different platform is to help you, to have a light platform. So it's a kind of an upgrade for us. And it's an important day because this is the first time in, I think, 4 years of webinars that we are testing and running a new platform. So you have on your right side of your screen a chat box where during the presentation you can make your question, you can make your comment, you can get to know each other. This webinar is also a little bit different because it's a different format. So it's not expected to have a presentation of the guidelines. This is a follow-up webinar from the previous webinar where there was this general introduction on the guidelines. UNICEF guidelines. Today, it's a question and answer sessions. Most of you have already posted your question in advance, and today the webinar is only Leslie and Zainab making the presentation. So I won't speak much, as you know, and are probably with these two very wonderful persons that they are very inspiring professionals for me. Leslie Snyder is a psychiatrist and public health professional, and currently the director of the Global Center for Child and Family MHPSS unit, hosted in Save the Children, Denmark. And Zainab is an MHPSS specialist, currently based in New York with UNICEF Child Protection Emergencies Unit. So I will kindly ask Leslie and Zainab to turn on your cam and your microphone, and I will hand over the conversation. Today, I won't be the moderator of pass it one to another. They will lead the whole process. I will just make an introduction, and we'll come at the end. So Leslie, I can see you.
Thank you. Thank you, everyone. Hello. And
Zainab,
thank you, Marcio. Can you hear me?
Yeah,
okay.
I can hear you.
Okay, great. Well, thank you, Marcio, and to the entire MHPSS.net team for organizing and hosting this follow-up Q&A session to the webinar that introduced the operational guidelines on July 27th. And hello to everyone. It's great to see you all here. Thank you for joining. As Marcio mentioned, my name is Zainab Hijazi, and I work with UNICEF within the Child Protection Emergencies Unit in New York. And I'm joined here today by a great colleague and friend, Leslie, who led the development of the operational guidelines and who is really the best person to assist me in answering the questions that you have shared with us for today's session. Leslie?
Hi, everyone. It's really nice to see everybody joining. I'm hoping that we have some colleagues here from Nairobi also joining. There's a team that I'm hoping is able to get online. And just want to say it's really a pleasure to be able to follow this through with Zainab in UNICEF, because we work together on these. So really nice to be able to follow this through and now as the guidelines are ready for field testing. So thank you, Zainab.
Thank you, and I'm just waiting for our PowerPoint to appear.
Yes, we are sharing it now.
Okay, great. All right, wonderful. Yes, so I really I just wanted to kind of start with, for those of you who joined the webinar on July 27th, and for those of you who didn't, just to say that during that webinar on July 27th, we provided you with an overview of the field test version of the UNICEF community-based MHPSS operational guidelines. It launched soon after the webinar, and during that webinar, we provided updates on the development process of the guidelines. We gave you an overview of the content. We then shared some steps forward in rolling out the field testing phase with the goal to further inform content, structure, layout, and use of the guidelines. And we will share some more information on that today. So as mentioned, we will utilize the first 10 minutes of the session just to provide you with some updates since the launching of the field test version, and do a very quick run through of the application and use of the guidelines, just given the nature of the questions that we received during and after the July webinar. And certainly, and the reason we are here today, we will use the remainder of the session to answer the questions that you and others submitted through MHPSS.net. There were a total of 22 questions, some of which we grouped together, but certainly we will do our best to answer all of them today. So it was essential to provide individuals, agencies who are using the guidelines with some materials, to support them in laying out the steps for applying these guidelines in their settings. And that's exactly what we did. So we developed an orientation package that will be available through a dedicated page on MHPSS.net on October 1st. It'll be listed as supplementary orientation material. And while we will not be getting into this package today, I did want to briefly show you how the package is structured. So as you can see, it will provide an intro to the guidelines and theory and concepts based on which it was developed, in addition to sections that cover access to the compendium's resources through a group on MHPSS.net, monitoring evaluation, guidance on adapting resources, an overview of community engagement and participation, and very importantly, a section that ties all of these components together, which builds on activities to assist the users in navigating through sections of the guidelines to support them in their programming for children and families. And of course, there's an online feedback form that will also be available through the guidelines dedicated page on MHPSS.net, which will inform revisions and improvements to the current field test version of the guidelines. Similarly, this will also be available and uploaded on October 1st. So before we head into the Q&A section of the session, I just quickly wanted to provide from the orientation material, more specifically the application module from the overall orientation package. So as you can see, we tried to answer some of the questions you had about the guidelines, including what these guidelines are and what they are not. We also lay out the ways in which the intervention strategies for each of the 4 layers within the ISC pyramid of interventions are described in the guidelines and where in the guidelines you can find them, and the way in which they are organized by the 3 tiers: child, family, caregiver, and community. The orientation materials utilize activities to help users navigate the guidelines. And this is a sample from the application module. As you can see, it will guide the user to build on existing resources and support in their own communities. So here we're asking them to make a list of resources and support inside their community where children and families can go to find support. And then we help the user establish specific needs relevant to disaster's impact on a community's resources, also impact on children and families. And then using this activity, the user is guided through sections of the guidelines, starting with the operational framework. So through this operational framework, we guide the user to establish layers in which the user or the agency, based on its capacity and resources and identified needs, the layer at which they can be directly involved, and layers with which this agency must establish referral pathways in order to meet the varying complex needs of children, families, and communities in humanitarian settings. For example, an intervention designed to work primarily at Layer 2 should also consider how to identify and refer vulnerable children and families for focused care at Layer 3 or specialized care at Layer 4. And then the user is guided to the compendium for selection of resources. And we, of course, support in accessing these resources. So we guide them to the resources through the dedicated group on MHPSS.net. And of course, within this, we also describe ways in which the agency or the user can link with other agencies who are working with children through a group forum as part of that MHPSS.net group. And the orientation material, of course, also includes snapshots and linkages to specific resources. So for example, when we're kind of guiding the user on navigating from layer to resource and whatnot, we also provide a snapshot of how the guidelines themselves orient the user on and direct them to specific resources that may support them in their implementation of interventions. And then the user is guided to the M&E section of the guidelines to support with selection of indicators and means for verification. This is the log frame that is as seen in the guidelines. So this is just wanted to show that to you really quickly. And then, of course, within the orientation materials, we provide examples and to help the user in the process of selecting indicators, as you can see in the slide. And of course, some considerations for selection of indicators as part of the monitoring and evaluation process. And certainly, one of the components promoted through the guidelines for successfully carrying out culturally appropriate community-based MHPSS programming is ways in which we would engage community in the planning and implementation of an intervention. And I think through the orientation material, we also link to specific sections in the guidelines that provide tips on how to do this. And finally, for the guidelines to be used in varying settings, it was important to provide orientation on adaptation and contextualization. And these are just some sample slides from the orientation material for adapting a resource as part of a more comprehensive guidance on adaptation. And so sorry for skimming through this section really quickly. I just wanted to give you really just a flavor of the orientation materials that we are currently developing and the way in which they are structured through activities by guiding you to specific sections within the guidelines and within the compendium. And I'm really looking forward to sharing this orientation package with you, and will ensure that you are aware and reminded of their uploading on MHPSS.net on October 1st. Now we begin with the part of the session that you all came here to join, and without further delay, we can jump into answering some of your questions. And depending on how much time we have left at the end, we may have time for follow-up questions as well. And I think now I hand over to Leslie.
Okay, great. Thank you, Nab. Can you everybody hear me all right? Yeah. So we'll start. I think I went a little too fast with that. Sorry. We'll start with question 1. Forgive me. I've got the hang of it now. So we'll start with question 1, and thank you, Dana from World Education, for this question. So you will see the name of the person who posted the question beneath that. So the question reads, how do you ensure that children have access to psychologists or psychiatrists that can speak their native language? This question is specifically asking about mental health professionals who may or may not be accessible in some contexts. So it is important to plan for and work to see how existing services can be made accessible to those who need it, and that they are of good quality. And that refers also to translation. So working with translators in a therapeutic situation has many important considerations. You have to think about confidentiality, the training of your translators, clear roles between the translator and the person who's doing the therapeutic intervention, and then support for translators who hear difficult stories. So this is a great question because it raises awareness of these issues, but it is beyond the scope of really what we can cover today, and also what is in the guidelines themselves. But I'd like to broaden out this question to include a range of community-based MHPSS workers, and maybe answer it more simply by saying that community-based means that it's implemented by community actors, social service actors, health, teachers, other community members, and this may help to ensure cultural competence, as well as being able to provide services in people's mother tongue, but not always. So communities are not homogeneous. There may be subgroups within communities, different dialects, and often refugees within the population being served who speak a different language. So for more information, I would refer people to the section on community engagement and participation. Okay, we'll go to question 2. And this question reads, if communities are trained to support children with psychosocial needs, but the adults need help themselves due to trauma they experienced, what happens then? Again, from Dana. Thank you for that question. This is a really important point. The operational guidelines work through the social ecological framework, and that recognizes that there are risk and protective factors in the family and in the community context that surround the child, also within the child. And these factors are essential to their well-being, and caregivers and family are highlighted as a special tier for this reason. So you can see on the slide some of the specific references. These are coming from layer 3 about direct support to caregivers and families. Some of these are supporting outreach services to vulnerable families for psychosocial support. Others are training and supervising lay staff to provide interventions directly to vulnerable caregivers and families, and also building capacity of families and caregivers in self-help and mutual support. And the rationale underpinning this, you can see at the bottom there, the presence of a stable adult caregiver aids children's feelings of well-being. And MHPSS interventions therefore promote the well-being of caregivers so that they can provide with a sense of safety, stability, and normalcy. So thank you for that nice question. Moving on to question 3, that's Zenab. I think you need to turn on your mic, or I need to turn off mine, sorry.
No, I need to turn on mine, yes.
Okay.
And thank you for this question. So the question reads, is there any possibility for disability inclusion? So as you know, the operational guidelines were launched as a field test version. So as we receive feedback from users through the feedback form that I mentioned earlier, we'll certainly start to establish gaps in content and resources within the MHPSS scope of the guidelines, and hoping to better address the needs of agencies who are working with children and families. So on disability inclusion specifically, UNICEF is currently part of an interagency standing committee working group that is looking at mainstreaming MHPSS across sections of the IASC, or Interagency Standing Committee Disability Guidelines. These are currently under development. So this work, I can definitely see it informing some content changes to the guidelines, and certainly the disability guidelines, once they are finalized, added to the compendium once it is finalized. And to note also that UNICEF does have disability guidelines that are included in the compendium, and throughout the guidelines themselves, there is language around inclusion and participation of children and families that exist across layers of support. In addition to the resource I just mentioned, within the compendium, there are currently some resources that are included for you here on the slide that promote rights of children with disabilities, and others that are specific to MHPSS programming for children with disabilities, including the IFRC training guide, Different Just Like You, a psychosocial approach promoting the inclusion of persons with disabilities. So throughout the guidelines, you'll see these little boxes that refer you to resources such as this one. In answer to this question, Habimana, so thank you for this. The question is really, after the webinar, what is your plan for disseminating the operational guidelines? So I actually wanted to, so this is actually the link. Here is the link where you can access the guidelines. But I also wanted to, quickly provide you an update on that, specifically for those who were did not join the July 27th webinar, is that the operational guidelines were widely disseminated through MHPSS.net, through the Mental Health Innovation Network, the Child Protection Alliance, through their social media channels in August. And they're now available online and can be accessed and downloaded through a dedicated page on MHPSS.net. The orientation materials I went over the intro will be finalized and uploaded to the dedicated page as well on October 1st, and we will continue to receive feedback on use of the guidelines through the feedback form. In addition, the orientation materials, you will find guidance on the files needed for local translation or printing of the guidelines. And of course, finally, the compendium will be regularly updated to account for newly available or launched resources that link with interventions described in the guidelines. And of course, in line with suggestions from users. So what you tell us is missing, or resources that you may propose to be included in the compendium. And it's actually for this reason that we decided that the compendium will not be released as a PDF or shareable soft copy. I see a question coming through where we can access the compendium. So in fact, the resources within the compendium have been uploaded to a group on MHPSS.net. I will make sure that that group, the link to that group, is also circulated to users or participants in this webinar, but also hopefully more widely. And I am an administrator of that group, and will be available, of course, to support and answer questions you have about use of the guidelines, or maybe locating specific resources in the online compendium, and also supporting through a forum discussion. So as part of the orientation that I mentioned earlier, that forum discussion, we hope to actually engage users through it and start to establish some topics and threads around resources, around content very soon. Another one for me. So the question from Asif Ali, how is UNICEF working on the cultural norms shattered and destabilized by armed conflict, and what is the best way to deal with psychosocial distress of the whole community? Such an important question. Communities and cultures are dynamic, and I included like a little excerpt from the guidelines on page 41. So communities, they're not static, they're also very diverse. And as you can see here, the guidelines specifically state that they change constantly as they adapt to new realities, environments, resources, and challenges, particularly after armed conflict. And changes can be seen through shifts in power and authority, where some groups who were marginalized before the conflict may encounter a change in their status or even become more marginalized. And so working and entering communities really requires skill and attention to be able to navigate the community structure and the cultural norms and the power dynamics that determine who participates in decision making and to what extent. And oftentimes there is an exclusion of vulnerable based on their ethnicity or religion or disability. So the guidelines provide guidance on carrying out a situation analysis that provides an overview of the emergency contexts, risks, resources, priority areas for intervention within a community. But a situation analysis should also identify the socio-cultural customs and ways of caring for and protecting children and families, which should inform the ways in which we engage with the community, and thus recognizing and acknowledging their resilience, capacity, skills, and resources for self-care and self-protection. And just in answer to the second part of the question on ways to deal with the psychosocial distress of the whole community, you'll notice that the theory of change developed within the guidelines, which explains how mental health and psychosocial interventions directed the family, caregiver, and the community can help to reduce suffering and improve people's mental health well-being. There are outputs specific to the community tier, and these include support to well-being and protection of communities and awareness. And you'll notice later on in the guidelines there are specific interventions that support in meeting this output, including raising awareness, stigma reduction, campaigns for people with mental, neurological, and substance disorders, child protection messaging. Second is activating natural community supports through engagement, and of course, finally, strengthening care systems through training of professional and lay staff in coordinated MHPSS care for children and families. So this is really just an overview within the theory of change, but you'll find within other sections of the guidelines we have very specific interventions that can be carried out at the community level as well.
Okay, I think this question is for me. How did the authors come to these guidelines exactly? And what was the methodology and the research behind them? So thank you, Kun, for that question. These guidelines drew from many sources in their development. One of these was the current state of evidence on good practices, and particularly the evidence and practice review that was developed in support of the Hague Consultation in 2015. There were also the consensus guidelines on good practice, of course, the main one being the IASC MHPSS guidelines themselves. And also there was a very careful vetting for inclusion of the recommended resources that went into the compendium. And Zainab, I wondered if you wanted to say anything about that vetting process before I go forward?
Yes, absolutely. So in 2015, we carried out an evidence review for MHPSS, specifically targeting children and families within humanitarian context. So that review of evidence and practice really helped us identify some of the resources that have been proven effective in the field. So it was very important for us to not include each and every resource we come across in this compendium, rather ensure that there was a selection process and some inclusion and exclusion criteria that went into it, just in order to ensure that we are promoting resources that we know that have been proven to work.
Okay, thank you, Zainab. There was also a consultation process, which is described here. This process was initiated in 2015, and that was following the IASC MHPSS reference group annual meeting. And there were different channels of feedback established to collect input on multiple drafts. And this included feedback from UNICEF colleagues in various sectors, and also from UNICEF field level staff. And these staff also contributed the case studies that you see in the compendium from the three countries. In addition to this, we had technical revisions by the members of the IASC reference group subgroup, which was the community-based psychosocial working group, which was the subgroup of that reference group. And you can see the timeline here on this slide. So we're right now in the field testing phase for 2018 and 2019, with revisions and finalization into 2020 and the launch in 2020. But the resources, the knowledge base that's being developed is really something that's live and continues. So I think, Zainab, I'm correct if I say that the compendium will continue to grow. Yes, great. All right. So next slide, question 7. Sorry. So what kind of specific activities would be similar across different community-based psychosocial support programs, since each is so context-specific? And are there elements that are absolutely essential, maybe even unique, to community-based PSS versus overlaps with other kinds of programming? It's a very nice question. Thank you, Amanda from Virginia. So there are principles of working that are common across all MHPSS programs. Those are articulated in the IASC MHPSS guidelines, as well as some other census documents. And these include in those guidelines the principles of working within communities, and within communities. So this operational guidance supports those existing consensus guidelines. I think perhaps that it's useful to think of community-based as a way of working, that it's based on things like participation and inclusion, and in the way it relates to how best to operationalize things like integrated programming, the multi-layered supports that we talk about, and how those things utilize existing community resources and capacities. For example, how do you create functional referral systems that link in with a particular community's resources and capacities? How can you be synergistic in protection efforts as you engage community actors and caregivers, teachers, with your child protection actors? So that together all of this builds a strong, supportive, social, ecological framework for children's optimal development. Everything needs to be contextualized. So all of this is translated into particular settings based on needs, resources, capacities, and culture. So we have very good models for interventions, but the important thing is localization. So the specific activities and how they're conceptualized culturally, contextually, how they relate to those resources and needs, all of this is contextual. The other thing that I think is important to keep in mind is how best do we assess and build relevant competencies in community-based MHPSS that ensure that you have quality in interventions. And there is work going on about that competency framework, particularly for non-specialists. I'll go on to the next question, and this is for Zainab.
Thank you, Leslie. Yes, and so the question here, oh, I'm sorry, I can't see the name.
Elizabeth Hall.
Oh, Elizabeth, yes. Elizabeth, thank you for the question. And the question reads, are there suggested protocols for instances when advice from the different sections of the guidelines are in conflict with one another? For example, when culture understandings of child-adult goals undermine child protection concerns, or when cultural understandings of privacy selfhood undermine therapeutic relationships in practice. And yeah, I mean, essentially, children, families, and communities may define their needs and priorities differently in each circumstance. And indeed, the challenges described in this questions are challenges we face in our work in general, and how we ensure that interventions do no harm and work towards the best interests of children. And while the guidelines lay out evidence-informed interventions and resources, in each program, different intervention strategies may be prioritized for adaptation depending on needs, resources, and contextual realities. And because not every cultural practice is good for children, the guidelines look at the child, but also at the environment that surrounds the child, and the need to increase the involvement and participation of individuals, families, and larger community is really, I think, a really core element of this. And so this is just also an excerpt from the from the orientation materials, but I really do think that this question points to the value of building relationships in communities to avoid setting up activities that are in conflict with local culture and norms, and further emphasizes the importance of adaptation and contextualization. So as you can see here, a well-adapted intervention will, of course, show respect for culture, for another's culture, value, and identity. It'll increase the relevance of your activities, and it'll decrease the possibility of risks and harm to target community. And really, that is extremely essential.
So this question is one of mine, and from Joseph Habimana. And there are 3 questions here, and they're wonderful. Thank you for these. I see them as really a call to action. So the first one is, why are there no funding mechanisms for MHPSS in humanitarian settings that are allocated to support local humanitarian organizations? So I think what is encouraging for us all is that there are existing advocacy efforts underway and that aim to engage donors and governments to better invest in MHPSS. And we're happy to say that they are really bearing fruit. They're bearing fruit with the Dutch government, German government, UK. We hope to do the same here in Denmark. And there is certainly local representation on those initiatives, but we can always do better. And I think we need to find ways for local actors to directly contribute to that dialogue and the priorities for funding, and of course that they can access those funds. So something that we've also talked about is, bringing sort of advocacy to local levels, and also for us as well, is how can we best as practitioners, as researchers, engage in advocacy, and maybe some advocacy tools for that. So stay tuned. We're certainly looking at this very closely. The second question is, how do you think MHPSS in humanitarian settings will be sustainable when local organizations are not highly engaged? And I think the answer would be that they can't be if local organizations aren't engaged. So localization is this priority of many key global platforms, including the Child Protection Alliance, the Child Protection Area of Responsibility. It is for us here at the MHPSS Collaborative. And perhaps it's a buzzword, but it is a way to highlight and ensure that we do things like using more human design approaches that draw on local knowledge and capacity. And our collaborative was actually launched with this as core to its agenda. So engaging local civil society in global discussions, feeding the local level experiences, and what it means on the ground. What are the realities on the ground that are being addressed, that innovations are being developed for, and feed those up into global discussions so that we can all learn. And also establishing more opportunities for lateral sharing. I think a really wonderful and inspiring publication is the one that you see there on the slide, the World Health Organization Building Back Better document that looks at how humanitarian situations, crisis situations, provided the opportunity to build back better mental health and psychosocial systems. The last question here on the slide is, what is your plan for localization based on MHPSS and humanitarian settings? And these guidelines were developed for UNICEF and partners. So I would say the answer to this is around that feedback mechanism that's being developed for field testing, and that hopefully will engage those experiences very directly through that mechanism. Zena?
Yes, thank you, and thank you to Lena Alvarez from World Child who asked this question. So which level 3 interventions for children are available, and from which organizations? So MHPSS interventions at the 3rd layer of the pyramid provide focused care to children and families who have specific emotional, social, health, and protection needs. So I actually wanted to guide you to page 34 of the guidelines, where we provide detail on each one of these types of interventions that you see in front of you that can be carried out at layer 3 of the IAC pyramid. So basic psychosocial support, which includes, empathetic listening, conflict resolution, psychoeducation, psychological first aid. A second area is focused individual and group support that is often provided by trained and supervised non-specialized providers or by mental health clinicians. And for this, actually, the guidelines provide guidance in line with standards in the IC guidelines. So we're through the guidelines, even though they are operational, they continue to remind us of the specific standards and principles in the main ISC guidelines. For example, within this area, we focus a lot on the importance of ongoing and support and supervision to non-specialists who are providing support at this layer. Another area is psychosocial competence building for parents, community, family members, and professionals. You'll see some sample resources here beside the areas of intervention. And of course, outreach and case management. And this is often for complex cases with specific needs that are addressed by other sectors as well, that require referral either to basic services or to specialized services when that service is not available or provided directly by the agency that is supporting at layer 3. And so throughout this section, the user, as I mentioned, is guided to the compendium and the resources that can be used to carry out this intervention or these different interventions. And I just wanted to also show you really quickly this table from the guidelines as well under the section that looks at layer 3 specifically. And so you'll see for each of the ISC pyramid layers, and here this table represents layer 3, the guidelines really provide a table of specific activities across the tiers of support. So child, family, caregiver, and community. So while I provided kind of an overview of the areas of intervention layer 3, this table will really provide you with very specific interventions that can be the different tiers of intervention.
Okay, question 11. This is from Lena, again from Warchild, thank you. Which interventions in MHPSS are suitable for children under 6 years old? So the operational guidelines are not structured, at least the field test version, is not structured in terms of activities for specific age groups. So we don't start from the vantage point of the developmental age and developmental framework for children. Rather, these are woven throughout the guidance in various places. So for example, you can find some of that information in the section on what other actors can do under health and nutrition and protection actors. So things like early child development activities, baby-friendly spaces. So again, you find this sort of woven throughout the guidance. However, there are links to specific resources in the compendium, as Zeynep has been describing, and some of the ones that are specific to this question would be Say and Play from Project Concern International. It's a tool for young children and those who care for them. There's the Interagency Guidance Note for early child development activities into nutrition programs, why and how, and the one that you see here from Action Contre la Femme on baby-friendly spaces. So you can find these various resources in the compendium and references throughout the guidance. Okay, Zeynep.
Thank you, Leslie. And yes, and another question from Lena. Are there some guidelines, resources for peer support interventions, and where to find them? So the peer-to-peer approach is detailed throughout the guidelines, but very specifically in 2 layers. In layer 2 of the ISC pyramid, you can see that on page 30. So in this section, we describe peer-to-peer as support to building social connections, teaching social skills such as empathy, and giving children the opportunity to learn helping skills and contribute to larger recovery efforts. And the approach, of course, is further described within the scope of interventions for adolescents with reference to life skills, peer-to-peer groups, and including groups that are specific to girls and boys, specific needs and interests. And of course, we refer to some key resources, including UNICEF's Adolescent Kit for Expression and Innovation, and War Child's Ideal, which is part of the larger life skills course called the Deals. But importantly, peer-to-peer activities for youth, but also mothers, parents, really can be quite powerful and provide more of that focused person-to-person support to address psychosocial distress and protection challenges. So example, peer-to-peer support resource in Layer 3 specifically includes the World Health Organization's group interpersonal therapy, which is a group activity that is useful in different age groups to help participants better understand and manage depression. As mentioned before, the compendium will continue to grow. And as new resources are made, we will continue to add them as relevant and if they are proven effective in the field. But one particular resource that I wanted to mention was the Child-to-Child Psychological First Aid Manual as well, that follows this approach that is hopefully coming soon. And I don't know, Leslie, if you wanted to add anything on that one specifically.
Yes, this is a really nice approach that I think a lot of people are waiting for at the moment. So it's an adaptation of the psychological first aid for child caregivers, looking at how older adolescents, older children and adolescents can actually support each other. And it's actually called I Support My Friends. It's coming out of Save the Children Japan, together with the Save Denmark, and it's a lovely intervention. The guidance is being finalized now. There's a large component of adult mentorship within this, so that children and adolescents don't take on too much in terms of the support they provide each other, but that they're supported as well. So we're hoping for a launch of that in early 2019.
Great, thank you, Leslie. And another question for me by Lena, how do you strengthen natural supports and systems and the community engagement when the population are passing through a country? So for example, refugees crossing the border and moving to different parts of the country. So to answer this question, I thought it best to refer you to a multi-agency guidance note that was developed around MHPSS for refugees, asylum seekers, and migrants on the move in Europe. It describes the challenges to mental health and psychosocial well-being among populations who have suffered hardships in the origin country, during transition, and in host countries. It provides a list of recommendation or recommended, I should say, MHPSS interventions, including very simple and practical guidance at the various layers in which you would support this group. For example, for those persons, requiring pharmacological care, whatever that medication may be, it's, for example, recommended within this guidance note to use simple health travel cards, so that refugees and migrants can carry their information with them. Because I think one of the most challenging things, and I think one of the most stressful things that this population goes through is, not having their information on them. And I think this is a huge, area of stress. And so through these just little things that we are able to provide them with, it really helps. And of course, note, it provides guidance on what to do, yes, but it also provides guidance on what not to do in order not to cause harm, such as, the guidance note specifically talks about not setting up psychotherapeutic treatments where follow-up is needed, because it's very likely that you will not be able to provide follow-up. So this is this question, we do kind of look at migrants within the guidelines. We don't have very specific information around this, but we thought it was a very important question that we would want to answer and refer you to this resource. Of course, we will add this resource as well to the compendium. This is just an example of, as kind of needs come our way, we will continue to kind of populate the compendium with resources that you will find useful for your programming.
Okay, This question has a few different facets. It's focused on the acute or early phase of emergency response and what should be considerations that MHPSS practitioners focus on in these phases. And although each emergency context is distinct, what are some of the essential approaches in the early aftermath, and what are reasonable and measurable outcomes for that initial phase? So, in particular, when we look at these operational guidelines, this is about working with communities in that initial phase. I would say one thing that should be kept in mind is the understanding of power dynamics within families and within communities, and how the crisis may have influenced those. So this comes back again to the principles of participation, inclusion, and representation, which is quite challenging in communities that have gone through disruption and displacement. So there's a real skill involved in doing this work in changing and often politically charged in contexts. So I would refer readers to the section on how to work with communities in these guidelines. There are specific tips there. Also, there are some, I think, standard frontline approaches that most MHPSS practitioners know about and utilize. Child-friendly spaces, for example, psychological first aid. I wanted to perhaps comment on child-friendly spaces because there was a lot of dialogue at that time related to the multi-country study on CFS as we began developing these guidelines. And what we wanted to be sure of is that we didn't throw the baby out with the bathwater. Child-friendly spaces are an important intervention, particularly for the protection of children in the immediate aftermath. What we understand from the study is that there is a need for more community engagement in the way CFS are set up, in the way they're staffed, in the way they're implemented and evaluated, and that we need also better quality MHPSS programming in order to demonstrate real impact from those for children. And this means also better training and supervision and support for CFS facilitators. I also want to link back in terms of the question about reasonable and measurable outcomes, and maybe take a step back to the assessment phase that happens in the early part. So you'll see one resource that's listed there on the side from WHO and UNHCR assessing MHPSS needs and resources in humanitarian settings. And there are other tools to be aware of. The 4Ws mapping. And so these and the IS guidelines provide a lot of additional information about early response. Zena?
Thank you, Leslie. And everyone, we're also very mindful that we're, almost an hour into the session, so we'll try to keep responses succinct and short, hopefully. But this is, I just want to read out these really, really important questions from Angela from IRC. And we decided to group these questions just because they all look at assessments in emergency settings. So just really quickly, the question reads, it is helpful to see the recommendation in Annex 7 on the humanitarian program cycle. Have the authors seen cases when emergency assessment teams have been willing to incorporate MHPSS questions into their tools, given the pressure and limitations of conducting extensive assessments in that stage? What would the authors suggest a few key appropriate MHPSS questions to use in MIRA or Child Protection Rapid Assessment? And some follow-up questions related to the above. Are there examples of engaging adolescents around MHPSS in the assessment and early phase of response? And what type of considerations and tools might be used to safely promote adolescent participation and adolescent voice as part of a community engagement assessment? I don't think I can do you justice in answering all of these questions in 1 or 2 minutes, but I will do my best. And it is really a great question, and certainly assessments are interventions in themselves, right? And they can cause additional stress for the population. And this is especially the case during the immediate aftermath of an emergency. So when we talk about, you're asking about considerations, I think the ultimate considerations are, do no harm and the best interest of the child. Really, they should be the primary considerations in any assessment. And so I will start by saying that we absolutely, yes, need to maximize the participation of communities in general, but certainly adolescents in the assessment phase. Because it's through their participation that we can get a better understanding of the situation of adolescents directly from them. But of course, we need to ensure that we have experienced assessors or experienced interviewers, so that we don't unintentionally put children and adolescents in harm's way. So a comprehensive MHPSS assessment that looks at specific mental health and protection issues should be carried out by trained assessors from the local community who also understand local customs and culture. So for example, interviewing an adolescent separately or in the presence of a parent. And a great way in my experience to engage adolescents is through focus group discussions, which informs early response, but also planning for more in-depth assessments. But finally, just for specific questions to be included in a broader or multi-sectoral assessment, I would definitely refer to the Child Protection Rapid Assessment Toolkit and the WHO UNHCR Assessment Toolkit that Leslie mentioned in her response to the earlier question. And these both are in the compendium. But while every context will be different, in the early stages of an emergency, really there are specific questions as part of an MHPSS basic rapid assessment or a multi-sectoral assessment, as you mentioned. And some of these example questions mentioned really quickly, and these are drawn from the tools from the MHPSS toolkit. And for me, successful experience in gathering this type of information has been really keeping them focused. So questions for the community about, the types of problems that people experience in the community as a result of the current crisis. So sometimes it's just about asking a very general question to see what mental health issues or problems come out that are related to how people feel, how they behave, how they think, or maybe even physical problems that they may have, that may be stress related. And of course, we can have very specific subgroups. So for example, say what are the kind of problems that adolescents experience in this community as a result of the crisis. And of course, we would try to find out the causes of the problem, what the community is currently doing to cope with the problem themselves, without external support, and what additional support would they need. And this is, really instrumental for of emergency. And of course, another key area I think is really easy to incorporate in assessments is just getting a sense of who's doing what, where, and when. And this is not to say we need to carry out a full-fledged mapping exercise, but just very quickly find out who's engaged in MHPSS, just so that in the early stages of an emergency, you're able to make referrals as needed to other agencies working in this field, or even other agencies who are not MHPSS actors where services may be required.
Okay, I'm going to go very quickly on this question. This one is about resources to train, supervise, and promote capacity building of community members to deliver Layer 2 and Layer 3 interventions. So I'll say three things quickly. One is when we're looking at these competencies, we have to remember that these may be delivered by people who have themselves undergone, suffered the same as adversity as the people that they're helping. So you see the Caring for Volunteers guide here by IFRC's Psychosocial Reference Center. And it's important to build in that support, the care for caregivers element into any training and capacity building program. The second thing I want to say, and it's already been said by Zainab earlier, is these models of not just training, but training, mentoring, coaching, and longer-term supervision that can build capacities over time and help lay providers to begin to respond to emerging needs. Because as they continue into the work, there's going to be new challenges that they have to address. And so it's good to keep the training going and the coaching, mentoring going. So this is a long-term commitment. And the third thing I want to say is that there are new initiatives looking at the competency frameworks for lay providers. WHO is doing that. So again, we hope that we have other nice new tools to add. I'll skip now on to question 17. How do we know if we're really helping? Well, this is the key question, isn't it? It points to many things: good program design, theory of change, ways to know if we're adhering to guidelines, advocacy also to donors so that they can recognize quality proposals. And we need to know the opposite of this is when we're doing harm or when we're not helping. So you can see a few resources there on the side that are included. There's a new MHPSS M&E frameworks being developed that hopefully will help us all to have some shared indicators and ways of doing this measurement. Question 18, Azena?
Yes, Mohammed would like to know if there is a possibility to translate this guide to Arabic in the future. Say, yes, I mean, country teams and agencies now have already conveyed interest in field testing, and translation of the field test version is now underway and will be available, although in draft form, since this is a field test version. And so far, we know the translation is ongoing in Spanish and Indonesian, but hopefully in Arabic and French very soon. And the translations, whatever translations are completed, I'll make sure, and I'll of course get the consent of the country team that led this process to make sure that they're uploaded onto the dedicated page on MHPSS.net. And this is just, the slide that I had showed earlier that will be available in the orientation package for agencies who want to print out or undertake the translation of the guidelines. And the final question, by Abdullah, is there a capacity building plan to cascade the knowledge to countries? In emergency countries, what will be the strategy to integrate MHPSS with ongoing emergency interventions? As I mentioned, the interest around the operational guidelines is definitely, we've definitely seen it because it's something that builds on the principles of the ISC guidelines, but provides more operational guidance around interventions specifically for agencies who are working with children. So the interest has definitely been great. And so, as mentioned also over the course of the session, translations are going through UNICEF country-led initiatives at the moment. And with the dissemination of the orientation materials soon, we really hope you will also be carrying out orientations on the use of the guidelines. So this is a really critical step in moving forward for us. And one way we will build knowledge is through local and global level interagency partnerships to field testing and rolling out of the guidelines, such as partnerships between UNICEF and the Collaborative for Child and Family MHPSS with SAVE. And quite importantly, I can speak about UNICEF in specific. Our UNICEF rollout in each country entails very clear strategic objectives around what areas of our MHPSS response to children and families needs and requires strengthening. And this is really the question that we start with when we approach and when we're starting to kind of look at the guidelines together, kind of establish how these guidelines can be helpful to our programming. And just very quickly also for the second part of the question, I would say that there are multiple entry points to the provision of MHPSS in emergency contexts, including through health, education, social services, but also through frontline workers who are providing water and shelter to affected communities. And so the guidelines are specific to the humanitarian setting. And so approaches, strategies, and interventions for MHPSS are included throughout. Implemented through a multi-sectoral, multi-layered, multi-tiered approach for the provision of services that essentially meet the varying and very complex needs of children and families who are affected by crises. And of course here, just very quickly, I wanted to refer you to Annex 2 in the guidelines, and which are based on the ISC booklet series. And these will provide you an overview of what other actors, and by other actors I mean non-MHPSS actors, can do in emergency settings. Thank you. I know we went a little over. I'm very sorry about that. And I am also sorry that we don't have time for follow-up questions, but I hope everyone found this useful.
Hi. Hi, can everyone hear me?
Yes, we can hear you, Marcio.
Sure. I don't know why my webcam is not coming up. Anyway, I want to thank you, Zainab, Leslie, for this very interesting session. And I'm sure we could go more and more if we would have time. I want to thank a lot everyone that participated in this webinar as well. We had a very good number of participants, about 40 to 50 participants. And we know that some people had issues with the connection. But again, this webinar will be posted very soon in our YouTube channel that you can watch again. Before you leave, I just want really to remind you to go to that link we just shared for the exit survey. It's very important, very useful for us. It doesn't take more than 3-4 minutes. Especially today that we have a new platform, a new webinar room. So we are very interested to hear your opinion. I take the advantage to announce that we are going to have another webinar very soon. In about 2 or 3 weeks time from now, October 16th, we have a new webinar on PFA, on the PFA review, the 5 years review that Leslie Snyder have launched not so long ago, together with Ananda Galapati. They are going to have a similar session on a question and answer related to this, to the PFA review process and the results and the insights and the challenging points. So you're going to get this information very soon in the next few days, more details about this PFA webinar. Thank you again for being part of this webinar. Zainab and Leslie, thanks once again. We very much, it's always a pleasure to have you here. If you want to say something before we close the room.
Yes, thank you, Marcio, and thank you everyone for joining. It's really been a pleasure. I hope we were able to answer all your questions appropriately and adequately. I do want to say, I know that there were some questions about how to access the compendium. I'll discuss with MHPSS.net and see how we can make sure it is clear through the main page of the guidelines how to access the dedicated group to the compendium with the uploaded resources. But thank you everyone, and of course, feel free. I am the administrator of the group, so if you have additional questions about the guidelines, please do post your questions or send me a question through MHPSS.net, and I'm always very happy to answer and support.
And thank you, Zainab, for this nice collaboration and inviting me. And thanks MHPSS.net and everybody. It was great to see the interest for this, and we hope it was useful. Thanks.
Thank you, everyone. So I'll be closing the room now. See you next time.